Menopause marks a powerful shift in a woman's life. But while hot flashes and mood swings are often talked about, there's a more serious topic we need to discuss: potential cancer warning signs that can appear during this transition. In this video, we're diving into the subtle and sometimes silent signals your body may be sending. Understanding these signs could make all the difference. Section 1. What happens to the body during menopause? Let's start with what menopause really is. It's the natural phase in life when the ovaries gradually stop producing estrogen and progesterone. This typically happens between ages 45 and 55, though it can occur earlier or later for some women. Hormonal changes during menopause impact more than just the reproductive system. They can influence bone density, metabolism, heart health, and even immune function. All of these shifts can affect how the body reacts to early cellular changes, including the development of certain types of cancer. So, while menopause is not a cause of cancer itself, the hormonal environment and age-related risk can increase susceptibility to certain cancers. Section 2. Why awareness is crucial. One of the biggest challenges is that symptoms of some cancers can mimic normal menopausal changes. Fatigue, bloating, weight changes, or mood shifts, these are easy to attribute to menopause. But when these symptoms persist or appear in unusual patterns, it's important to pause and pay attention. Early detection is one of the strongest tools we have when it comes to managing health outcomes, especially for cancers that are more common in midlife. Unfortunately, many women dismiss early signs, thinking they're just normal changes of aging or menopause. That's why knowledge and vigilance are so important. Section 3. The most common cancers to watch. For during and after menopause, certain types of cancer become more common due to hormonal changes and aging. Let's talk about the main ones and the early warning signs to know. Breast cancer. Look for a lump, thickening, or unusual changes in the breast or nipple area. Skin dimpling, nipple discharge, or changes in breast shape may also be indicators. Endometrial uterine cancer. A major red flag is bleeding after menopause, even if it's light. Also pay attention to pelvic pain or a feeling of fullness. Ovarian cancer. This one is tricky because symptoms are subtle. Bloating, pelvic discomfort, urinary changes, and changes in digestion, if persistent, should be evaluated. Colorectal cancer. Look for blood in the stool, changes in bowel habits, persistent abdominal pain, or unintended weight loss. Bladder cancer. Warning signs can include blood in the urine, frequent urination, or pain while urinating. Remember, these signs don't always mean cancer, but when they're unusual, persistent, or worsening, they should prompt a conversation with your healthcare provider. Section 4. General warning signs not to ignore. In addition to symptoms related to specific cancers, there are general warning signs that women should watch for, especially during menopause. Unexplained fatigue that doesn't improve with rest, sudden or unintentional weight loss, loss of appetite or persistent digestive discomfort, skin changes including new or changing moles, chronic pain, especially in the abdomen, pelvis, or back, changes in urination or bowel habits. Many of these symptoms are nonspecific, meaning they could have multiple causes. But if you notice more than one, or if any single symptom is ongoing, it's best to get a professional opinion. Section 5. What's normal versus what's concerning? A lot of people ask, how do I know what's normal for menopause and what isn't? Here's a simple rule of thumb. If the symptom is new, intensifying, interfering with your daily life, or not improving over time, it's worth getting checked out. For example, occasional bloating can be part of hormonal changes, but daily, persistent bloating over weeks should not be ignored. Likewise, spotting or light bleeding months or years after periods have stopped is not considered normal and should be evaluated promptly. Section 6. What you can do today. Now, what steps can you take today to stay proactive? Know your baseline. Understand what's normal for your body so you can recognize changes early. Stay on top of regular screenings. Mammograms, pap smears, colonoscopies, and pelvic exams all play a role. Practice healthy lifestyle habits. A balanced diet, regular movement, stress management, and avoiding tobacco all reduce cancer risk. Listen to your intuition. If something feels off, don't delay asking your doctor. Early conversations can lead to early answers. Being proactive doesn't mean living in fear. It means staying empowered with the knowledge to protect your long-term health. Thanks for joining me in this important discussion. Remember, your health is your greatest investment. If you found this helpful, please share it with someone who might benefit, and check out my other videos on women's health, menopause, and wellness. Don't forget to subscribe and hit that bell for more insights like these.